My name is Carla Carl, and this is my narrative on my new legislation for research on medical cannabis. The new legislation that I'm proposing today is to gain grant money in order to do research on medical cannabis. Currently, there's only been minimal research conducted, so there's not a lot of statistical value out there to show what the benefits are, what the risks are, what are the long-term effects. What is the liability? Has there been any issues with anyone that have had negative effects from this? All of this needs to be researched significantly, and that's what this new legislation is about. So how do I propose that I'm going to be able to do this? Well, my proposal is to take a percentage of the tax revenue from the sale of current medical and recreational cannabis in the 23 states. Colorado had $7 million in tax revenue in just 6 months. Imagine the amount of money that we could put aside for the use of research and long-term research at that. It could give us significant statistical data and also provide human clinical trials, which could give us the information that a lot of us have been waiting for. So medical cannabis or medical marijuana is still against the law. It's actually on the Schedule I drug list along with drugs like heroin and cocaine. It was put on that list with the Controlled Substance Act of 1970. The first state, though, that has legalized medical marijuana is California in 1996. There have been 22 other states that have followed in their suit and have medical marijuana approved, as well as some states actually have some recreational use of marijuana. There still has been minimal research and statistical data to provide the information to be able to use this for a medical use. What I found interesting is actually the United States Department of Health has a patent US 6630507, titled Cannabinoids as Antioxidants and Neuroprotectants, that actually they have the rights to this. They note that it's good for arthritis or Alzheimer's, but it's still listed on the Schedule I federal drug list with heroin and cocaine. Not sure why, but that's the case. So what can this research provide? It can actually provide some clinical trials, different strains. There can be, long-term effects, benefits for other illnesses, and the different strains for like migraines or joint pain or nausea, and even a more clear answer as to what's already been researched. If they keep getting the same results, is that enough? Is there long-term research that needs to be done? Basically, the biggest problem is we need to get answers on the cannabis that we're providing for medicine. Statistical research over a 10-year period actually provided some very interesting information. For the prescription drugs that the FDA approves, there's been over 1 million deaths due to those, and those have significant amount of research that have been provided before it was even approved by the FDA. Same comes true for some food products. Over 8,000 people have lost their lives due to problems with food products that have also had significant research done. So even some major stakeholders, like the National Cancer Institute, has actually stated that because cannabinoid receptors, unlike opiates, which are found in, narcotic drugs for pain, receptors are not located in the brainstem areas controlling respirations. A lethal overdose of cannabis or cannabinoids does not occur. That's why there's not been one documented case of cannabis death or overdose. Another interesting fact is that the Academy for Pediatrics is actually recommending that the U.S. Drug Enforcement Agency reclassify marijuana so that more research can be done. They want to be able to help children with debilitating or life-threatening illnesses. With it still being on that Schedule I drug list, it's making it very difficult for research to be done. So target population right now, there's quite a few things. I just wanted to highlight a few. PTSD. It's interesting to know that 7.7 million Americans suffer from PTSD. Sometimes we hear a lot of it in the military. The U.S. Department of Veterans Affairs says that at least 22 veterans commit suicide every day in the U.S. And according to a study conducted by the RAND Corporation, it says 20% of people in the military, which is 2.7 million veterans of the Afghanistan war, have some form of PTSD or depression. Could cannabis help that? Could it provide them some relief? I know there's been some stories that I read where people have actually used recreational cannabis aside from trying to use it through trying to use their medication they were prescribed because the medication didn't work for them, but the cannabis did. Another one is epilepsy, which is there's 15.5 billion with a B billion dollars a year are spent on epilepsy. There's 2.3 million adults that have it and 450,000 children that are affected. This is just one case of one child. Her name is Charlotte Figge. The picture on the left is Charlotte. She had over 300 seizures a month, and her parents tried everything that they could, regular prescription drugs. She was actually in hospice care when they heard about and decided to go check on the cannabis oil. And the picture on the right is actually her today being treated with medical marijuana. So there's been some great increase. She's actually able to do a lot more things than she was ever able to do before. So who is in support of this legislation? Well, there's doctors that are in support. They want to help they want to be able to help as much as they can. There's a Dr. Sue Sisley, a psychologist that worked at the University of Arizona, wanted to actually do a study on veterans and to be able to help them. Unfortunately, she wasn't able to do that study, and she was actually let go from the university because they weren't really ready for that kind of research. They didn't want to have that on their name. Patients want the best thing. If there's things out there that they're not able to use, or if there's medicine out there that they're using and it doesn't work, that's something that's definitely very important to them. They want to be able to use or try a new medication. Then there's also the Realm of Caring, which is a counseling center that actually will help people and being able to understand the medical cannabis. They can give the counseling and the understanding and the education around it. And then the Stanley Brothers Enterprise, which actually produce the same medication the Charlotte Figge used in order to reduce her epileptic seizures. Now we come to those who would oppose the legislation. The first and foremost is going to be the pharmaceutical companies. We spent, as Americans, $234 billion a year last year on prescription medications. If it's found that medical cannabis can actually help with even one major illness, such as cancer or heart disease, that this could actually be a serious cut to their bottom line if the research is able to prove that. Another one is the private prison systems. The corrections office actually wants people to get arrested for medical marijuana. They actually spend over $1 million a year lobbying for efforts to keep it illegal because, in fact, they're losing money if they don't have people that they need to house for breaking the law. In the end, with all of the positive outcomes that have come out from just the last 20 years, it's time to do the research and find out what the full benefits of cannabis are for medical purposes, as well as the risk. Clinical trials will provide much of the needed answers. With Americans becoming more on board with the use of medical cannabis, now is the time for real research to begin. To provide the grants that are needed, the research that's needed, and the clinical trials. If, with the Health and Human Services having the patent on medical cannabis that they say can be used for Alzheimer's and arthritis, it's time to start backing up that patent with some real research and some real results. In the end, bringing back the quality of life naturally is very important. Will this drug provide a way for a person with severe pain to stop all medications? It's all in the research, and we have yet to discover that in full. Thank you.